Hello everyone, I'm Dr. Ricardo de Sousa Jr. I'm a physical therapist and I'm here today to present the recently published paper Modify Sports Intervention for Improving Participation Goals and Activity Competence in Ambulant Children with Cerebral Palsy, a randomized control trial. And I'm here today representing this amazing team that I'm acknowledging here. About 14% of Brazilian children with disabilities, mostly children with cerebral palsy, participate in physical activities. This is one of the main functioning priorities of families of children with CP, especially those classified as GMFCS levels 1 and 2, the ones that are able to walk without assistive devices. So modified sports interventions are sport-focused interventions that aim to promote participation in physical activities in children with disabilities. And one modality and one program that represents this intervention is the Sport Stars. Sport Stars is a modified sport intervention that was originally developed in Australia and was adapted for our culture here in Brazil. And it emphasizes the physical literacy components that are important for children to participate in physical activities. We promote in this intervention the locomotor and object control skills training. And after that, we introduce children to different culturally relevant sports such as soccer, handball, basketball, and athletics in order for children to put together all the information that they trained in the locomotor and object control skills training in a context of real life and sport participation in groups. So the objective of this randomized control trial that I'm presenting now was to evaluate the effectiveness of SportStars Brazil in comparison with usual physical therapy care on different outcomes such as leisure time physical activity participation goals, motor skills capacity and performance, body functions such as agility, muscle power and balance, physical activity levels, physical literacy, and also overall school and community participation. In this RCT, we included 38 Brazilian children with CP aged 6 to 12 years old, and we divide them in two different groups performing the random allocation. They were in the SportStars Brazil group or in the usual physical therapy, individual physical therapy group. The allocation was secret and the evaluators were blinded by the group allocation. We collected data at the baseline, after 8 weeks of intervention, and after a follow-up of 12 weeks. SportStars Brazil is a modified sport intervention that is conducted in groups of 6 to 8 participants, as you can see in this picture here. This intervention is led by a physical therapist together with physical educational professionals and also academic students from both majors. First, we start with a warm-up period, followed by a skills training, locomotor and object control skills training. After that, we conduct introduction to different sports such as soccer, handball, basketball, and athletics for the children to put together all the things that they trained in the locomotor and object control skills in a real-life sports practice scenario. This intervention is a very low dosage intervention. We conducted this intervention in 8 sections. All of the sections were in 1 hour and 1 section per week. As outcome measures, we evaluated leisure time physical activity participation goals using the COPM. For motor skills performance, we also use the COPM, and for motor skills capacity, we use the challenge test and the TGMD2. For body functions, agility, muscle power, and balance, we evaluated by using the muscle power sprint test, the Temper 5 sprint test, and the mini best test. Physical activity levels were evaluated using the accelerometers. Physical literacy was evaluated by the PLP Quest, and community and school participation were evaluated by the Pencil-I. These outcomes, we evaluated changes after the intervention and differences between SportStars and usual physical therapy groups using linear mixed models and considering intention to treat analysis. Here's some of our results when we compared SportStars Brazil with individual usual physical therapy. We saw that SportStars Brazil presented greater improvements in leisure time physical activity participation goals at post-intervention, and it was kept in the 12-week follow-up. Also, this group presented greater improvements for motor skills performance at post-intervention and also at our follow-up, and also similar improvements in motor skills capacity and physical literacy in comparison with individual physical therapy care. And no differences were seen in the remaining outcomes, the physical activity levels, the body functions, and participation in school and also community. In conclusion, SportStars Brazil was effective in improving leisure time physical activity participation goals in ambulant children with CP. This intervention enhanced participants' motor performance and fundamental motor skills, and also reached comparable results in motor skills capacity in comparison with children that were in the individual physical therapy group. We didn't find improvements in physical activity levels, body functions, and also overall participation after the SportStars Brazil, and we consider that this result was because the intervention was very low dosage and was a short intervention that was not capable to promote improvements in physical activity levels and also body functions. But we also consider that this modified sport intervention is an effective and low-cost approach that has potential to be implemented in clinical practice, especially in some scenarios just like ours here in Brazil, that we need more low dosage and low cost interventions for our children. I hope you guys like this paper, and if you have any questions, please reach out so we can discuss more about modified sports intervention and also about the SportStars Brazil for children with cerebral palsy. Thank you.